In early January, I started feeling a lot of swelling and tenderness on one of my fingers. After about a week, it seemed like it was getting worse, so I figured I should go to the doctor to get some antibiotics, because I knew it was infected. I hadn't found a new GP since my insurance changed a year ago, and I'd been meaning to go in anyways. They had a same-day clinic for situations like this, so I got an appointment for that morning. Great. The doctor was great, and he diagnosed it as paronychia, an infection around the nail bed, and he prescribed clindamycin. Within 2 to 3 days, the swelling and tenderness started to subside. About a week later, I got a bill for $260. Then a couple days later, I got a bill for $104.93. I'd given all of my information to the doctor's office, and I paid my $15 copay. I called the contact number on one of the bills and gave the operator my insurance information again. She told me these bills were 2 separate charges, one from the doctor and one from the hospital clinic for the use of their office. This means that if I was a cash patient, they were going to charge me $364.93 to go get a prescription for antibiotics for an infected finger. That would suck, but I'm not living paycheck to paycheck, so I could have eaten that. I'm an ICU nurse at this hospital, though, and I see people all the time who don't have insurance and can't afford these costs. I hear things like, I ran out of my blood pressure medicine, or he couldn't afford to go to the doctor to get treated for diabetes. So what happens next? Maybe he has a massive stroke. What's the consequence? First, it will cost us, because we all eat the cost of the uninsured, at least tens of thousands of dollars just to get them through their acute hospital stay. Many days in the hospital, with multiple doctors, nurses, sophisticated monitoring equipment, CT scans, MRIs, and surgeries. If he survives, and if he's lucky, he'll go to rehab for days or maybe weeks. If he's not lucky, he'll get what we call a trach, peg, and sniff, which means they'll place a breathing tube, a feeding tube, and send him to a skilled nursing facility where he will be cared for indefinitely. How many people can pay for this on their own? The estimated mean lifetime cost of an ischemic stroke in the United States is $140,048 per patient, including inpatient care, rehab, and follow-up care. It doesn't include lost wages of the patient or lost wages of the family members caring for him. Also, we often get patients in their 40s and 50s, so they still have families that depend on them. Could our system be better? Well, of course. How do we stack up against countries with socialized medicine? Do countries with socialized medicine ration care? Well, yeah, but so do we. Except we ration care according to a person's ability to pay instead of according to need. The other thing is, we spend more than those countries as a percentage of GDP. A lot more. We also spend more per capita. So at least we must be getting better care, right? Wrong. Say what you want about the problems with socialized medicine, but compared to those countries that our politicians criticize, we're fatter, we're sicker, we die younger, and we have higher infant mortality. Maybe it's time for us to get serious about universal health care.